Okay, great. So there's a few things I want to show you guys today because most of these Sims and the movement analysis, task analysis app, they're kind of tied to the NeuroExam course. So without further ado, just to introduce myself, my name is Michael Wong. This is probably around my 20th year in entry-level DPT education. And I'm just excited to share with you things that I hope can enhance your classroom and make your life easier as a professor. Man, this year was not that much easier than last year for some reason. And I think the use of a lot of the apps in the classroom have really helped to augment and create an environment that is professional, that's stable, that's dependable, and to have a large video library to enhance the way we teach motor skills, I think has just been completely invaluable. So I hope that this will be a useful time for you, and I'm happy to take any comments or questions. Please feel free to stop me anytime. Just raise your hand or write a note in the chat, and James usually bumps me off the stage and tells me a little bit about some of the questions that you guys might have. So let me go ahead and get started here. This is Jackie. Jackie is one of our, she's our neuro professor. And you can see that in the classroom, she is demonstrating different techniques related to NeuroExam. The students are all following along, and most of them have already previewed a lot of these video techniques. So that's one of the things that we're really excited about, is having a library of professionally filmed videos of techniques that students can watch before they come to lab, so that lab is not the first exposure, that multiple exposures over time are perhaps the better way to teach motor skills. So I'll show you a little bit of how we do that. There were three big questions that we were thinking about when we were building these apps. The first, one of my dear friends, Dr. Kathy Kumagai, who was part of building of this app, she said to me, Mike, that's not fair that ortho has all the videos. I have a ton of techniques and examination procedures that I need to teach, and all of these are in some big white binder full of black and white pictures and words. Could we film all of this? I'm like, Kathy, that's fantastic. Let's do it. So the question was, could we introduce NeuroExam procedures in an efficient and long-lasting manner? Efficient meaning I don't need to film them, I don't need to organize them, and they're easily deployable to all of my students on all of their devices anytime they want to look at them. The other thing I would say is how we teach motor skills today, because there is high quality video that we can depend on, that model can change. So we do this in our ortho class, we do that in our clinical skills class. The students pre-watch all the techniques that they're going to learn in that week. In some of the studies some of the survey data that we collected and presented at ELC, students reported that it greatly reduced my anxiety in lab to come prepared, to know what I was going to be taught. And I would also say intuitively that when you see the students come in, that they have watched these techniques before, many of the times, your ability to scale up the clinical reasoning, to talk about why and when I would apply these techniques, you have so much larger capacity in their minds, because they're not so desperately trying to write down everything that you're doing or film everything that you're doing. So I think all of us who teach lab heavy classes can recognize that that is the common thing that happens. They don't know what's coming. They're desperately trying to keep up with you. And before you know it, we've run out of time to finish the entire lab. I mean, it's just so common. The second thing we were really trying to answer, and this is after the first pandemic year, the question was, how can I enhance application and develop early clinical reasoning related to NeuroExam of real patients? So we missed being able to bring in real patients. So we filmed real patients and created mini simulations so that students could now apply their knowledge in asynchronous and low stakes environments. Just let them play, let them make mistakes, enjoy applying the knowledge that they have acquired. And the last thing I'm going to show you today is a glimpse at the new task analysis app, which I think it's just an incredible opportunity to bring patients into your classroom. This was another app that was spawned, so to speak, out of what are we going to do now that we don't have patient day? Well, how about PhysioU goes into the home of many of our common patients and film all the common activities of daily living and allow that to be a platform for faculty to engage the students, to create the opportunity for task analysis. So I'm going to show you these three things. Let me go actually directly into the app for a second. So if I go here into PhysioU, so for those of you who don't have PhysioU yet, please know that PhysioU is available for all faculty for free. We built this so that it would support you as an educator. The students are the ones who support the, paying patients, programming, filming, all of those things. So when you sign in, you'll note that usually you use your faculty email. You'll see that I don't need to sign in anymore because I just click remember me. This is up anytime I'm teaching. PhysioU is up because then I can leverage resources from all across the curriculum. Right? I can jump back to neuro if I'm talking about balance. I can jump back to range of motion MMT if I'm talking about something that needs assessment of shoulder range of motion. So I can jump around in the resource and help the students re-access this resource because what they've told me is, man, these apps save me when I get out into clinic. I'm so thankful that this resource that I learned with in lab is the same resource that I have carrying in my pocket. So if I go to the NeuroExam app, I'm going to go over here. I'm going to close this little sidebar for now. We'll revisit that in a second. You'll see that the NeuroExam app is a comprehensive library of pretty much all the key tests that you are going to do, you're going to teach in your course for NeuroExam. So everything has been filmed. This is Rachel Tabak Tran. She was the director of neuroresidency at Casa Clina, right by our university, dear friend and actually almost a neighbor. And you can see she does a brief introduction. This is what the Fuglemeyer is for. So she talks about it briefly. So the students watch this on their own time. Let me just give you a sample here.
The Fuglemeyer motor assessment measures motor control through examining the ability to move the upper extremity and lower extremity in and out of pattern movement. This test is designed to be used in individuals after stroke. For all items on the motor assessment, first assess passively for range of motion through the desired movement for each joint being tested. Next, demonstrate the movement that you will ask your patient to perform. Your patient is to first perform the movement with their less involved arm or leg. Your patient then has 3 attempts to perform the movement as flawlessly as possible with their more involved arm or leg. Coordination tests are only to be performed once. Speed, coordination, and movement excursion are all to be considered when grading your patient's movement. Movement should not be facilitated during this test, but verbal instruction and encouragement is allowed.
So you can see that there's a nice summary of all these key major tests. So here's side-lying synergy. Here is the different tests. If we go further into NeuroExam, you can see here sensation, protective sensation, and functional sensation. So let me just give you a quick glimpse of how we've organized that. Here is functional sensation. And then let me move into tone. So all of these techniques, let me just give you a quick sample of Actually, let me move to balance for a second here. So for example, 5 times sit to stand. This technique that the students have watched before they come to class, the reason they've watched it before they come to class is because, one, either you can use something that PhysioU provides for all faculty. So if you go to the sidebar, you can go to the complementary resources. Here, you can see teaching content. In the teaching content, we have created lab handouts that are already directly matched for classes that have very predictable labs. We've created generic lab handouts for you to modify. So for example, in balance, here's a Word doc, and then here is a PDF. You could use either. You can just take out whatever you don't want to teach. But if, for example, if I open the document, all of our lab handouts look the same. So it creates a uniformity of that experience. And you can see that all the instructions are all matched exactly to the app, the grade score, and the video is hyperlinked. So you can just click on it and the students go and watch the videos before lab. So this is what happens in our ortho class, happens in our neuro class, happens in our cardiopulm class, because you have this library that's already set up for you. The other way to do that, so like I mentioned, we have lab handouts for the entire NeuroExam app. Every section already created for you. You can just modify it, upload it to your LMS. The students have lab handouts already that are matched, videos, instructions, everything matched. The other thing that you could do is, Mike, I already have my own lab handouts. How can I leverage the videos and the pictures from the PhysioU apps? So what you can do again is you choose the technique. So we're talking about balance this week. I open the sidebar. I copy page title with link. I go to my lab handout, paste that item here. Now you have the title with the link. It's automatically dumped right into your lab handout or your lecture. So anytime you click on this, it will open up PhysioU. If the students are logged in or you're logged in, you don't even have to log in. It just opens. The other thing you can do is copy thumbnail image, because we believe that the students create a visual roadmap in their mind. They bookmark things with visual cues. So we think that it's very useful in lab. This is what we've done for all of our ortho labs now. Every technique has a matching picture, so that when they see the picture, it triggers something in their mind. It helps with storage and retrieval. So every technique in the entire NeuroExam app, so let me go back to the NeuroExam app, is now available for you to link into your lectures, link into your lab handouts, and the resource is always there. You don't have to worry, is this video going to be missing in my YouTube video, right? Or trying to dig out all of these videos organized inside your Google Drive. Everything's already pre-organized for you. So if I were to take you a little bit further, if you look at 5 times sit to stand, you'll see the instructor basically demonstrating the technique.
With your arms folded across your chest, stand up and sit down as quickly as you can 5 times. Your timer will start when you say go. Are you ready? Set, go. 1, 2, 3, 4, 5.
So there's the purpose of the technique, the equipment that you will need, what is the patient and therapist position, what are the cues, when to stop the timer, and how to interpret for fall risk, as well as the citations related to the test. So your entire NeuroExam, balance, coordination, right? All of these videos are now available for you to leverage. And now faculty, in my mind, it means that faculty can now spend more time thinking about how to craft context, how to help students apply this knowledge in a clinical setting, because we've taken out a lot of the heavy lift of trying to have these videos available or demonstrating every single one of these techniques. I commonly in my ortho class will pull up a video on PhysioU, show something that, because it buys me a minute of freedom from being in the spotlight to think and craft how I want to talk about these techniques. It's like a backup that you have that you can always leverage. So here are your gait measures. You have DGI, FGA, FAB. And based on some of your feedback, we also filmed we have all the tests in all the little pieces, but we also did the full test. So we filmed the full test so that you could just show the whole thing, or the students could watch the whole thing in conjunction, all combined. So you have different options of how you want to demonstrate these tests. So you've got Fullerton Advanced Balance, you've got the high mat, so you've got all the gait measures have been filmed for you. And then let me just finish off this app by saying that we have organized all your diagnosis-specific examination strategies or tests, Fugl-Meyer and Stream. You've got Asia, okay, motor and sensory. In our program, we have agreed across ortho, neuro, and the fundamental skills class to follow the Asia style of myotomes and dermatome testing to reduce the frustration of the students who keep saying, why is the ortho guys teaching neuro screen different from the neuro guys, and the neuro guys teaching it different from the fundamental skills year one group? And so we've just all agreed to standardize. And we just use PhysioU to do that. Here's your vestibular test, oculomotor exam. Here is more vestibular testing. Here is balance exam, central signs, all of these different tests that are probably my suspicion, and I'd be very curious to get your feedback on this. I'm hoping that this covers the bulk of the techniques that you're teaching in your neuro class. And then lastly, the cranial nerve exam. All of this has been filmed for you. So just as a refresher, remember that we have lab handouts. I get them through this sidebar here, complementary resources. All of this entire app is already mapped out in a lab handout for you. So when I click on that, it takes me to faculty resources. It brings me to teaching content. And in teaching content, I have lab handouts. And that takes me to my NeuroExam. All the lab handouts are built for you. If you don't want to do that and you just want to augment your own labs, then it's just as easy, because you can now go to any technique and copy page title with link. So let me just pause for a second. That in a nutshell is the NeuroExam app. I'm happy to show you guys, if there's certain things that you want to see, please just unmute yourself and let me know if there's anything that I can show you that you want to see, or if you have any thoughts or comments about this.
The chat is clear right now, Mike, but I put a couple comments in one. First of all, your contact information.
Yes.
If you guys want to do a follow-up with Mike and schedule an appointment, do a virtual coffee with him, so to speak. The second thing, just plain old email. I put that out there too, his email address. I have a kind of a starter question there. Those who are using PhysioU, how has it helped you become more effective and probably hopefully a more efficient teacher? Work smart, not hard. And the last thing I'll say is that you get to pick and choose. I mean, if you want your students to get a head start on some of the ocular motor tests, say, hey, go look at this here real quick. So you can use it. It doesn't supplant the teacher at all. It really just augments what you're already giving them and teaching them. So I really think that's a good way for this. So, but if anyone has, have used it, or for example, next semester, I'm going to be doing, balance stuff or whatever, let us know. Mike can actually go over some of that stuff specifically right now
Yeah.
and say, hey, here's what we have on it, and here's where you go. And I think that's the thing too. I like to say, I like the way, Mike, you say, let the students go play,
Yeah.
and also the faculty member go play and see what's out there and see how you can use it, not to supplant you, and it's not a panacea, but to help augment your teaching opportunities.
Right. So let me just pause for a second and see if you guys have any feedback or any comments about the NeuroExam app. Any thoughts from anybody?
From the little bit that you guys have just seen Mike present, is there anything that an obvious omission or missing that would be helpful in your teaching?
This is Rhonda. I think everything is good. It's just a matter of me having time to know what's there. I think I still just go into panic and do what I've always done mode in terms of looking for things. And then I come to courses like this and I'm like, oh man, it's already there. And I did all this extra work. So some of that stuff I get, it's not overwhelming because it's not simple. It's just me and my learning curve. So I think it's wonderful. I don't have any complaints at this moment in
Great.
regard to it. I do have one quick question though. I do get lost on how to find the labs sometimes, and maybe that's a issue of mine, just navigating the actual apps versus the website.
Yeah. Remember that there is this little side tab here. That side tab has your educator resources, which includes not only how you're going to add videos to your lab handouts, but the complementary resources. If you click on the complementary resources, it takes you to this faculty resource page. And if you scroll down, you'll see teaching content and your lab handouts will be there. Our team is working on making the lab handouts even easier to get to. Soon, it will probably be right in either in this sidebar or somewhere within the app. You could directly link to that, to the exact lab handouts. There's a lot of things that we have to think about and negotiate with the programmers because they have a very set way of trying to keep the platform very clean and organized. But complementary resources is your go-to place. The other thing I would say is that just for you to get a glimpse of, you saw that I clicked on the NPT and CAPTI standards. All of these apps are mapped to these standards. So if you look to the NeuroExam app, here is your different PT standards. So just for those faculty who need to add this to their syllabus or people who are going through CAPTI accreditation, this document is here to support that effort. Any other comments or questions? And I saw your comments here in the chat about people going to augment their lab handouts. I think if I were to give you a little bit of advice on how to deal with something as massive as PhysioU, you think about what is the primary thing that I can enhance my classroom with. And at the very fundamental level, the simplest level, it is purely, I can now use videos to augment my lab. My students should be able to watch all of these techniques before they come to class. And all of that is done by augmenting your lab handout. So I would say that is a call to action to any faculty member who's teaching a lab class. Can you augment your lab handouts with good video? PhysioU is there to support that. And secondarily, there's a call to action for the students. Guys, motor skill development is not an easy thing. And that is why it is important before you come to class, you watch the videos for that day's lab. You will find that it will help you to learn things much better. That becomes a habit in our class. I told them at the beginning, the first day of ortho, this is how labs run. You can now do that with the Neuro suite of apps. Pretty much everything you need to teach, we have filmed already for you. So I would just say your call to action as a faculty member at its simplest level is, how can I add these videos into my lectures? How can I add these links to my lab handouts? And it makes it so easy. Let's say students go out sick. They have all the techniques already on the lab handout. And oftentimes, back in the pandemic, if I had 10 people quarantining, I would just play the video in front of the class, talk about certain things, stop the video along the way. And then everybody got a fair shot at seeing the technique done. Any other comments or questions?
There's a question in the chat from Stacy, and it's a great question. You know, she's already seen the prosthetic gait thing, but how about just a prosthetic or orthotics content? You know, and I think maybe we assume that they already know, you know, the different types of prostheses that are out there. And maybe Stacy, you can unmute yourself and clarify if I'm not clarifying your question for you well. You know, just what is but first of all, what are the different types of prostheses? You know, and stuff like that. So I don't know, Mike, if you have a comment on that.
I would just say it's on my list. It hasn't been in the Gait app. We have all of this prosthetic gait videos, but I think, Stacy, you're asking for pictures and videos of the common prostheses. Is that right?
Yeah, I just teach that content. And so while I use the prosthetic gait videos, I was just wondering if there was anything else already in there regarding that content in general that can be capitalized on.
If Stacy, if you don't mind connecting with me in one of the meeting links, I would love to kind of pick your brains about what that should look like, because that isn't my specialty area. I mean, that's how we build apps anyway, is really just a faculty member says, hey, what do you think about this? And then I will say, well, what does that look like? What would you need to teach that? Is it a picture of a device and its purpose and how it's applied generally, and some common things to watch out for? Or is it a video of a prosthetist working with a patient so the PT students can now see how that device is applied? Like, there's so many different ways to organize that content. So I'd love to talk with you more about that.
Yeah, I might touch base with you down the road. I just wrapped up that course and I won't be starting it again for a while. My focus will turn back to neuro, but down the road we can.
Yeah, absolutely. Yeah, perfect.
There's one more comment in the chat, Mike, and it's something that is a great comment. Huang Kyung, if I'm not pronouncing that correctly, I apologize. Yeah, I think that if the curriculum, the whole program uses the PhysioU, there's consistency, and the students know that when you do an ortho, you go back and talk about the rotator cuff. We go back into, go back and look at the palpation app and the anatomy app, and it's all consistent. Like you said, the Asia thing, we're consistent on that. And so, yeah, and I think then the student goes, hey, this is a textbook that I use in all my classes. What a great value, instead of buying one book for each class. Yeah, so I think that's a great comment we see in the chat.
Yeah, I think, Hua-Kyung, what we do at APU is, and in many other programs, we've agreed that this resource is the standard resource to basically standardize practice across all the instructors too. So that an instructor can say, like, I'm in orthopedics, and I'll say, guys, so what landmarks and what are you stabilizing when you're doing a range of motion for shoulder flexion? I don't have to hope that what the instructor taught in the year one is the same way that I do it. We just open the app and we know that we've standardized to that. So across our curriculum, across neuro, so what you guys can see here is we've grouped the apps based on the key categories. So in the neuro rehab group, you've got NeuroExam, NeuroRehab, PNF, task analysis, and NeuroSims. So all of these are used across the board by the faculty, and we just talk about stuff. We make sure that we are synchronized, so that we don't confuse students with a lot of the variations of practice, which generally, I think most of us agree, has not been good for the profession. I mean, orthopedics is a great example of variations of practice. Thankfully, the new clinical practice guidelines that all of our apps are built upon have standardized that. It gives us a platform to generally agree on what techniques should be taught and how those techniques should be done. There's a lot more guidance now because of that.
The thing about variation, Mike, I love the term unwarranted variations. I mean, there's Ford, Chevys, and Toyotas out there, and they're all cars that get you from point A to point B, and there's variations of that, but it's the unwarranted variations and so we try to help that with the evidence-based thing. Mike, you want to sneak a peek at the chat? There's a great question there.
Yep.
About gait from
so
Hussein.
Prosthetics that Stacy is referring to. It would be good to have gait deviations. Yes.
We have that already in the prosthetics.
Yes. So let me just give you a quick segue to that, and then I'll move into the simulations because I think that's a big deal. If you go to the GATE app, you will see that in Analyze, we have deviations, and we have filmed all the common prosthetic deviations for transfemoral and transtibial. So if you go into, for example, knee instability, and this guy is a professor, actually, he will perform. So he basically took the battery out of his knee and demonstrate. So he made the list for us. What are all the common forms of instability or gait deviations with these different prostheses? So you have front, rear, front view, front slow motion. So very similar to how we would practice as a clinician, different views. Here is the associated phase. Here is the potential cause. And then here is the potential penalty. So all of that has been filmed for you already. It's in the GATE app. Let's see, I hope that's Lucine, great. I hope that's useful for you. Let me move into the simulations. Okay, so the simulations is a really, really cool concept that I think you will find useful. The question we were trying to solve was, is there a way to create clinically rich, contextually rich environments for the students to apply their knowledge? You will see that PhysioU is building mini sims and macro sims. So if I go back to my slides for just 1 second, here is just a compiled list of the sims that we have built. Okay, so I'm going to go back to that slide. So the mini sims are filmed on real patients. They are meant for the students to do them over the weekend or to do them in class. The macro sims are also filmed on real patients. They are way more involved, and I'll give you a glimpse of what they look like. So the mini sims, let me show you the mini sims first. Mini sims take about 5 to 10 minutes. They are application, a little bit of synthesis. It's higher up on Bloom's taxonomy. It's kind of low to middle of Bloom's taxonomy. When you look at the macro sims have a lot more synthesis. So the student goes through and watches the evaluation or elements of the evaluation. They're asked to interpret the findings and create treatment plans. So it's a lot more involved, and those should be interspersed throughout the curriculum at appropriate moments when they have enough knowledge base to actually start doing decision-making. The mini sims are just fun dopamine hits for the students. They're just having fun applying their knowledge. So a good example of this, I always like to use timed up and go, but you can see that there's a number of these. When you click on it, what you'll see is there is a course key. The course key allows faculty to see exactly what is going on in the game. So let me just talk you through it very briefly. When you click through the course key, you will see that the student is going to apply the knowledge that they've learned about timed up and go and actually do the test and interpret the test with the patient. So actually, let me go into the game itself so that I can show you what it feels like. So essentially, we go to that sidebar, we copy the title with link, and we just embed it into the syllabus. Guys, at the end of balance week, you need to do this sim. Please turn it in digitally at the end of the weekend. So our students just play with it asynchronously. So here is the game. 65-year-old male with Asia D spinal cord injury, having difficulty with balance during ambulation. Which test is appropriate for assessing his fall risk? So they go timed up and go. What is the appropriate setup for the timed up and go? So I'm going to go 3-meter path with marker. Let me see here, 3-meter path with a chair and a marker, good. How should a patient begin the timed up and go test? So they're drawing on previously known knowledge, seated with back against chair. When do you start it? So time is started when the therapist says go. Time is started when the patient's back leaves the chair. So we're going to call that the right answer. And now we perform the test. So we start the video.
All right, so what you're gonna do is when I say ready, set, go, you're gonna stand up using the walker. You're gonna come around this yellow piece, the blue piece of tape. You're gonna turn around that tape, come back to the chair and take a seat, okay? All right, so ready, set, go.
Okay, his back leaves the chair. I start the timer. Okay, so he goes through the whole procedure. So I'm going to stop the timer. Now, if you follow the whole video, there's a certain time that the students will get. So in the next question, we ask them, what time did you get? So we make it as realistic as possible. So 1 minute and 12 seconds. Great. Please interpret your findings. The patient took 1 minute and 12 seconds. What is your recommendation? Sometimes the students can't quite remember, so we add the hint. And then we go back to the hint and we'll go greater than 30 seconds. Okay, he needs to use assistance. He should use assistance when ambulating in the community. Correct. We've added in a little bit of questions related to movement analysis. So we talked about what movement faults do you see, decreased hip extension, decreased step length, decreased dorsiflexion. So whatever little things that, and then you can rewatch the video. So I'm just going to click through it. And then we ask them to make a connection based on some of the impairments that you've acknowledged that you put in that last question. What would be something useful that you might consider doing to help this patient's movement? So I'm just going to click through. When the game is done, the students have the opportunity to do it again. They can go back and review the questions and see what they got right and wrong. And when they're done, you can see that there is a learning record. Okay, so I'm signed in as me. This is my learning history with this game. And our students know that I am happy if they want to play it as many times as they want to get 100%. I'm happy that they're playing with games instead of learning games instead of Candy Crush or whatever games they're playing these days, right? So they download this learning report. Here's their highest score. That means they've done it enough times to get it 100% right. Here are the dates that they've done it. Here is the time that they've spent on it. I mean, how often can you tell whether the students are engaging in your material? Now you can. And I'll tell you, this is not, you're not pulling teeth to make students play with these. They're having fun, learning. So here's the game. Here's who did it. Here's the date that this report was issued. And you can also verify that this is actually not a doctored document. So just to give you, so just know that right now we've only released a bunch of these mini sims. So you can see that there. The MacroSims, let me give you a quick glimpse of that. I've just pulled up the key for you. So let me see if I can find the key. Hang on 1 second. The key looks like this. Okay. So this game is about 50 slides long. It includes watching the instructor go through a comprehensive physical therapy eval and treatment of a patient who experienced a stroke. There are high-level questions. That's why these are higher level on Bloom's taxonomy. So you will interpret patient history and the clinical scenarios. You'll understand side effects. So now we're bringing in pharmacology. What are some common side effects of medications? You will analyze data from the outcome measures. Oops, let me go back here. You'll analyze data from the outcome measures to guide clinical decision-making.
Mikey, I'm going to interrupt for a second. If Christine put, where is that located? Christine, if you can specify what is that? what is that? They're asking where's what located?
The mini sim, the
Oh,
mini game he was just in.
Yeah, the mini sims, all of our e-learning components are here. When you log in to PhysioU, you'll see all e-learning components are purple. Here's the NeuroSims. So all of your mini sims are here, and they're available for you to now go to Timed Up and Go, copy page title with link, and drop it right into your syllabus, Command V. And that is, students know that this is what they need to do that weekend. They turn in their learning report into however you accept assignments.
Perfect. Thank you.
You're welcome. So just so you can see this game, the stroke game. So what you're seeing here is a little bit of our process, meaning after we build the game, so I'm going to go through, you can see James and other instructors going through every single part of the game and giving feedback. So these games, so-called games, probably take, man, a better part of 25 hours to create, another 10 to 15 hours to go through and refine. And then we would bring it back to a clinical expert to go through again. So the time investment and cost is extremely high, but we just think it's so important for students to be able to play out their clinical reasoning, right? And the other thing I would say is the key is available for faculty. So what I was showing you was the key.
So hi, I'm Sarah. Can you tell me what your name is?
My name is Patricia Chase.
Okay, and Patricia, can you tell me why you're here in therapy?
I had a stroke on May 6, 2013.
Okay. Did you have any trouble thinking or remembering or anything like that?
So they're watching a clinical expert. This is Sarah Kraft, who created the NeuroRehab app, going through the entire subjective. And then they go through and they click on different parts of the eval as they gather information. So this is how they gather the information. Eventually, there's questions, right, about different things. I've kind of run through this game and chosen things. So, but as you run through the game, that we're asking the students to acquire knowledge or acquire information through the subjective or the objective, and then to interpret it and to make a call. It's low risk, it's low stakes, but it's so important to allow them to apply their knowledge. So let me actually take you to a couple of questions related to the, let me move forward here. I'm just gonna keep going. There is answers and feedback for pretty much the entire game. So I'm gonna go on here. Here's a medication question. The patient is taking several medications. Swelling is a common side effect. Which of the following medications? So not only can the students use this, but within PhysioU itself, they can pull up the medication, look at the side effects, because, and here are the implications for rehab, because we've built a pharmacology app, because we think that's how integrated education should be. So the game begins to connect content that they've learned across the curriculum and ask them to apply this knowledge. So I don't want to spend too much time on this. This will be out very soon. We've vetted it. There's 3 of them. There's a vestibular, there's a stroke patient, as well as a spinal cord injury patient. They will be available for you to scan through the key, to look at how the game is, what the students are going to be doing. Towards the end of the game, if I close this back down, you'll see that the students are asked, right? You can see all these responses. We have written feedback for the entire game so that students do not end up leaving completely confused and frustrated. That's another really key element as we've learned in building these in PhysioU. When you create these relatively complicated, that's why we split them from mini sims to macro sims. The macro sims are more challenging. They can also be infinitely more frustrating. And so we've tried very hard to create a partly formative experience so that you as the faculty will not be left with 50 students who are confused, right? That's the death of any product that wants to be used for education.
You know, Mike, I'm going to interrupt real quick. You answered a question that was in the chat from Regina asking you when these will be deployed, and you said soon. I don't know if you have any more objective time, like before the end of the summer, because she's getting ready for her neuro class in the fall.
Yeah, it will be done before the fall. So it will
Okay.
come out in the summer release.
Yeah. And then the other thing too, I mean, just I put in the chat how, like, you know, the cross training of ortho to neuro, where you know your paraplegic has shoulder tendonitis from the wheelchair propulsion, and they can go back, student go back and look at the ortho app and look at what do you do with shoulder tendonitis. And now you just showed how, like with pharmacology, go back and review your pharm. So they have it all there. And the beautiful thing here too, Mike, and I'm going to get ahead of ourselves maybe, but they'll have this on in their pocket on their phone in the clinic when they go do that, and then they're using it to study for boards. Yeah. So yeah, and I think it's a great tool.
Philosophically, what you're beginning to see is there's a faculty member's job is to begin to create context and figure out how to deliver content into a relatively scaffolded mind. Like, I don't think we should think of students as an empty box and we just dump stuff in there. Like, I think the scaffolding is so important, meaning how do I create context to help them understand why I'm teaching them things? And as we teach them skills, there's a pathway to learning motor skills, and that's multiple exposures. It's graded exposure. That's what the videos are for from PhysioU. At the end of that delivery of content, there has to be an application moment before you move on to the next area. So that's why we built all of these little mini sims and macro sims, because once the students can apply it once, it kind of shakes all the pieces into place. And now they're ready for the next delivery of content. So I think all of us recognize that some of those elements, all of those elements in that order generally help students to organize and recall information and apply information better when they get to the clinic. So the last thing I'll show you on this game is the students are given findings. The students are given outcomes of different tests. And then they are asked to plan something that would be useful. So list at least 3 of the functional impairments that would benefit from physical therapy intervention. Whatever they write here will show up on your learning report. Okay, the next question, include a treatment plan and appropriate outcome measures. They write it out. It's all synthesis. It's all low stakes. Just give them a place to play. Give them a patient to play with. You'll be surprised at how much your student's mind can evolve as you're using these mini sims and macro sims as a way to let them just shake up and use the tools that they've been given. So that's a glimpse of the mini and macro sims. Macro sims will be out by fall. These mini sims are already available for you to use. The last thing I want to show you for today is one of my most favorite apps that we've created, because there was so much engagement with the client, with the patient. They were so excited to be part of this. They already were coming to our patient days. And now they're like, wow, I can be a part of every neuro instructor's classroom. They loved it. Okay, so here we have the task analysis app. In the task analysis app, we believe that the pedagogy of modeling is very important. So in the learning component, we have Sheets task analysis and Headman movement analysis. In the Sheets version, what Mary's done is she has filmed with these different patients the video of their movement. Here is a side view. And then here is a simultaneous view. Okay. Then what she's done is she has written up initiation. Here is her analysis, initiation, and movement system diagnosis. Execution. This is what Mary has written. So a clinical expert has gone through and written this whole analysis up so that instructors could use this as a way to help students understand how this is done. Then Mary went ahead and wrote a SOAP note. So here's the SOAP note related to this task. In the Hedman version, so I'm going to go to the Hedman version, you'll see that there's a number of patients, patient who suffered from a CVA, toileting. Some of these are videos of typical patients. Okay, so I'm going to go toileting here. Whole task, initial condition, preparation, initiation, execution, termination. So they're kind of different styles of movement analysis or task analysis. And each of these videos are those key moments, right? Here's initiation. Here's execution. All of this has been written up by Mary. And then here is the documentation, the SOAP note. So now that learning component is done, the students have something to model after. You can now go into the practice component. In the practice component, we have filmed all the elements of the sheets analysis.
All right, so now what you're going to do is you're going to step up and touch the top of the steps. You don't have to step onto it, just touch the top with the right foot, then your left foot, right foot, and then your left foot, or left, right, left, right.
Okay.
Okay, ready, set, and begin when you're ready.
Okay.
Okay, so the video is there for you to play in class. The students have these cues and they have a worksheet. So you can download the worksheet. It's going to be a little bit small, but you'll see that the worksheet here is now available for students to just fill in. What is the body part? Preparation, initiation, execution, termination. They can just start filling it in, right? And then you could have a discussion. You could call up a student. Please tell us what you found. So if I go back to the app, what I want you to see is that we have filmed. So under sheets, here is all of the tasks. For Hedman, what you'll see is we have filmed almost all common activities of daily living in the context of the patient's home for the typical female, typical male, patient with COPD, patient with right total hip replacement, CVA, right-sided hemiparesis, and C5 spinal cord injury. So just for example, if you go in here, you'll see that all these common tasks we have filmed. So now you can watch John going through the process of cooking. You can view what he's doing. So I'm just gonna move over a little bit here. You can also view it from a different view. So here's John. Same video, different perspective. You can see John going through the process of grooming, shaving, dressing. You have a close-up view as well as a wide view. So let me just go here for a second. All of these videos are now available for you to create an interactive classroom. You can even assign these as homework. And then you have the comparison to typical. So there's me getting dressed. Eventually, you can have the students do case studies. So what we did for case studies is we took these different clients. We gave you the history. This is John's story. And here are the top 5 tasks, 5 or 6 tasks, from getting up and down stairs, getting in and out of his car, mowing the lawn, sweeping the garage. And these are all just little tasks that we can have the student go through and do their task analysis. So all of it's been filmed for you. Let me just take a pause for a second and get your comments, your thoughts. What do you think about the task analysis app?
I think it's great, especially during COVID times. Our students haven't been able to do observation and see patients while they're doing their clinical work, before they go out into their clinicals.
Awesome. Yeah, that was actually the large impetus for why we wanted to film it, because patient days, as all of us know, are so difficult to coordinate, so difficult to manage. And now you can do this in place of patient. I mean, you can't replace patient days for sure. We've started up again, but I think having this tool at your fingertips means it is an integral part of your class, and you can seamlessly go to it at any point.
It helps them put it all together.
That's right. It really helps.
The video, like trying to explain, like, you know, if someone who's never had experience with a CVA patient, try and describe John putting on his sock with that little, you know, the pull up thing or whatever, and try and describe that versus just see it. Oh, that's how they do it. You know, it's like trying to describe the ocean if you've never seen it, you know, type thing. So
Right.
stole that from Jimmy Buffett. Sorry.
Yeah. Other comments or thoughts?
Stacy's asked, we're on the, we call it an app, but you couldn't find it on the app stores. So what's
Okay.
like that thing? Yeah.
Stacy, when we first started 7 years ago, we were an app in both the Google Play Store and in the App Store. And eventually what would happen is that PhysioU, every time we loaded up a new app, we would basically have to, every single one of these is a completely new app, which would take, every time you found a typo in one of the pages of an app, you would have to re-upload it to the Apple Store. This is a web app because now it is available on anything with a browser. The students use it on their iPads, they use it on their computers, they use it on their phones. It doesn't matter whether you're Android or Apple or, you know, PC. So it is not in the App Store. It is purely in the web app because it allows us to create incredible things without the restraints. Like Apple would never allow us to have this many videos in an app because it would eat up an entire phone's memory. The web app allows us to continue to add content for students indefinitely and make updates easily. So it's only found on the web at, you know, PhysioU.health. Other comments? Any thoughts as we close out the session here?
Real quick, Mike, this is being recorded. Someone had to leave early. The appointment came up, but you'll be sent a link to this recording shortly in next early part of next week, if not sooner. And then I also put in the chat Mike's contact information, so you can take a look at that to follow up with any questions you have with him that you may think of after we conclude today.
Yep. Other comments from faculty, thoughts about how you might integrate this into your classroom, things that I could show you or questions you might have?
This is greatly. The big thing I need to do is just do it.
Yes.
And just start.
You will be surprised. You do it once, it changes the game for you because you can now pick and choose which techniques you need to show. You don't have to show them all ever again. There are certain techniques in ortho that I don't show because they're so straightforward, and it saves me energy and capacity to be able to craft what stories I'm going to tell them, how I'm going to help them understand how to apply these things. You'll be surprised at what a relief it is to now integrate all these videos into your lab handouts. That's the first thing I would say to do.
Mm-hmm.
Yeah.
Yep. First time learning to use it, Christina and Rhonda, I think you guys comment about like, boy, I just got to, you know, get oriented to it and stuff. It's kind of like whenever I have a new textbook, it's like, oh, I got to realize, you know, where the chapters, how they reorder the chapters, whatever. After third or fourth time using it, boom, I know exactly where to tell the student to go. And that's what will happen with this too. As you use it more, you become more familiar with it. And the students will too. They'll know, they'll be very efficient when they go out in the clinic on their phones, look stuff up. They'll already know how to do it because they've done it multiple times during the curriculum.
And you'll see, as I showed in the video earlier, we make a point to use the app in class regularly because a resource that is not used by the professor often is not used by the student. Think about any textbook that they never see us open. You have a really good chance that they're not opening it either. But when I open the app and show them where things are and show them how, like when I talk through videos of technique, they're following along and going, wow, that's where that is. Okay, now I know how to use it on my own. So I make a point to share with faculty, the more you use it to make your life easier, the more the students learn to use it to make their own life easier, right? So it's just like any textbook. The more you reference it, the more you show them what's in there, the more that students will find it useful.
Mike, I have a favor to ask of you for me, and that is, Stacy tried using the schedule the appointment link. Can you
Yes.
check on the chat and see if I mistyped anything? It could be sorry, Stacy, it could be pilot error here.
Yeah.
Because she says she's trying to get on but couldn't link. It didn't work.
I just want to thank you guys so much. I have to jump onto a meeting at 1.
Okay. Thank you guys so much. We will send out an email. Yes, something might have gone, there might be a broken link. Let me actually grab that meeting link for you. Any other questions? Any other thoughts? And I'm going to re-put in this meeting link for you. Comments or questions? Any last comments? And I'm going to put my link back in here for you. Let me just double check that it works. Yes, there it is. So you guys now have the link. You should be able to reach me, and I'd love to be in touch with you if you have thoughts or ideas. If you have comments about things that are missing or aren't correct, please feel free to just take a screenshot, send me a quick email. The beauty of this app is you never have a second edition or first edition. It's always the latest edition. So that's the reason why we built this, is because we can continue to evolve the content as the profession changes. So in closing, I would just say that we have a session next week. Let me go right to the back here. And that is the NeuroRehab app, as well as the PNF app. I know there's definitely a conversation about PNF and its place in the curriculum. I'm excited to talk with you about it next week. So any other last thoughts? Thank you guys so much for joining us. James and I are here just to chat. If anybody wants to stay on and chat for a bit. Yeah, thank you for spending the morning with us. And I hope this is useful for you. And I hope you have a great weekend.